Join me as I dive into the controversial choice of RFK Jr. as health secretary and see if I can uncover the real impact of this decision. In a shocking move, Donald Trump is reportedly considering vaccine skeptic Robert F. Kennedy Jr. for the position of health secretary. This decision has sent shockwaves throughout the medical community, with many experts warning of the dire consequences that could follow. But what does this mean for the future of public health in America? We're living in a time where vaccine-preventable diseases are making a comeback, and the anti-vax movement is gaining momentum. Vaccine skepticism has been linked to outbreaks of measles, mumps, and whooping cough, and it's estimated that tens of thousands of lives could be lost if this trend continues. And at the heart of this movement is RFK Jr., who has been vocal about his beliefs that vaccines are causing more harm than good. RFK Jr.'s stance on vaccines is not only controversial, but it's also completely at odds with the scientific consensus. Study after study has proven the safety and efficacy of vaccines, yet he continues to push the narrative that they're somehow responsible for autism and other health problems. It's a dangerous ideology that's having real-world consequences, and it's baffling to think that someone with these views could be in charge of America's health policy. The implications of this are staggering. If RFK Jr. becomes health secretary, he'll have the power to shape policy and influence the decisions of healthcare professionals across the country. It's a prospect that sent shivers down the spines of many in the medical community who are already struggling to combat misinformation and pseudoscience. RFK Jr. has a long history of spreading misinformation about vaccines, and his influence has been significant. His book, Thimerosal, Let the Science Speak, has been widely debunked by experts, yet it continues to be cited by anti-vaxxers as evidence of the dangers of vaccines. And his organization, the World Mercury Project, has been accused of spreading misinformation and propaganda about vaccine safety. As a prominent vaccine skeptic, RFK Jr. has built a large following online, and his influence extends far beyond the anti-vax community. He's been praised by conspiracy theorists and alt-right activists who see him as a hero fighting against the so-called deep state medical establishment. It's a dangerous alliance that has real-world consequences, and it's terrifying to think that someone with this level of influence could be in charge of America's health policy. But what about the reaction from public health officials and the medical community? The response has been swift and unequivocal, with many experts condemning Trump's consideration of RFK Jr. for the position. Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, has spoken out against RFK Jr.'s views, saying they're dangerous and misguided. The American Medical Association has also weighed in, saying that vaccines are one of the safest and most effective ways to prevent the spread of infectious diseases. The general public is also speaking out, with many taking to social media to express their outrage and disbelief. It's clear that the vast majority of people understand the importance of vaccines in preventing the spread of diseases, and they're not afraid to say so. But amidst all the outrage, there's a small but vocal minority who are celebrating RFK Jr.'s potential appointment, saying that it's a victory for medical freedom and informed consent. It's a worrying trend that highlights just how divided America is on this issue. As we weigh up the potential implications of RFK Jr.'s appointment, it's clear that there are risks and benefits to consider. On the one hand, his influence could be used to promote public health policy that's based on science and evidence. On the other hand, his views on vaccines could have disastrous consequences for America's health. It's a delicate balance that requires careful consideration, and it's essential that we get it right. So what do you think about RFK Jr.'s potential appointment as health secretary? Should someone with his views on vaccines be in charge of America's health policy? Let me know in the comments below. And if you want to learn more about the debates surrounding health policy, be sure to check out our video on the pros and cons of mandatory vaccination. Thanks for watching, and we'll see you in the next video.